Hi, Mrs. Smith. It's Molly, your nurse. I am coming in here today because I know that we are doing some discharge teaching, and I want to teach you using a teach back method, meaning you teach it back to me, how to do your dressing change. One of the reasons why we do dressing changes, which you will need to do daily, is because we want to help decrease the bacteria that is introduced to your surgical incision when you had surgery for your gallbladder removal. We want to make sure that we keep it dry, clean, and intact, and you want to keep doing this every day until you follow up with your physician next week. Some of the risks that we have with not having a covered incision is that you could have bleeding, and you also could have infection. So we want to keep this area dry, clean, intact, like I said, and I'm going to teach you how to change the dressing, removing the old one, cleansing, cleaning the incision, and then putting a new one on. So the first thing that we're going to do, something that you want to do from the beginning, is you want to wash your hands. Then you will have your supplies, which we will give you when you leave. So you'll have that supplies already. So you're going to have gauze. You'll have a couple of these. One that you'll use to cleanse your incision, clean it, and then one to cover it. You'll need some tape, and you'll need some normal saline, as well as trash and gloves, like a trash bag, and you'll need some gloves. We'll give you all of this when you leave. Anyways, so what we're going to do is we have all our supplies, and so we have our trash bag and our gloves and everything, so let's get started. We're going to wash our hands with soap and water, or you can use some type of antibacterial solution. You want to make sure that you do that. Then you want to put on some gloves. Then what we're going to do is we're going to remove the dressing that you already have. You can do this by just touching it on the corners, taking your dressing on the corners, on one of the four corners, and removing it, making sure that you're just touching the outside of the dressing. If you need to moisten it a little bit, you can use some of the saline, which is basically a salt water solution, to kind of loosen it, because we want to make sure that your skin, we don't rip any of your skin. If it's easily coming off, then you can just simply take it off your skin, throw it in the trash. Then what you'll want to do is take some of the salt water solution, saline, which is the same thing, and we're going to just put, not touching it directly, but just putting some of the solution on the dressing so we can cleanse it. You want to take some gauze, and you want to just cleanse around the incision. You always want to cleanse in an outward position, going out toward, going out, using an outward motion. You never want to cleanse inward. You want to clean outward, so you'll use an outward motion to clean the incision. Take that gauze that you just used to wipe that salt solution off of your skin and to clean your incision, throw it in the trash, okay? You also, the gloves that you have on, throw all that in the trash too. Then we're going to wash our hands again, or use some saline, some antibacterial solution, one or the other, but you want to make sure you do one of those. And we will have our brand new materials, like gauze that you have not used. Not for cleaning, not your old dressing. You want to use new gauze. So what we're gonna do is we're going to take our gauze, clean new gauze. Oh, I'm sorry. Well, actually, after we wash our hands, we'll put on new gloves as well. We will take our new gauze, and we will, touching the outside only, one of the four corners, we will put the gauze on top of our incision, not touching the incision. Then we will take our tape, and you can rip it like four pieces like this, and cover the sides of the incision, making sure that you kind of seal it up. You know, you don't want to have holes and cracks in the gauze, in the outside of the gauze, because you don't want to let water get in there. We don't want it to stay moist where bacteria can grow. We want it to stay dry, clean, intact, like I said, as such. Okay, sorry. All right. Then, once you do that, tape it down on all 4 sides. You are done with your dressing change. Then you want to take your gloves off, wash your hands again, and then you're done. So let's do a teach back method where you teach it back to me. Okay, and if you have any questions, or if anything happens to where I need to kind of redirect, we will do that. And then you'll be able to go home and perform your dressing changes safely and the way that they need to be done, so that we do not spread any bacteria or cause any infections or anything like that. And if you have any questions, you, of course, let me know.